We welcome you to our module Other Significant Endocrine Metabolic Disorders, HCC 23 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of other significant endocrine metabolic disorders. At the end of this module, the learner will be able to describe hyperparathyroidism and differentiate between PHPT and SHPT. Identify the ICD-10 codes that fall under hyperparathyroidism. Discuss the criteria for the documentation of hyperparathyroidism. Review the example of the assessment and plan for hyperparathyroidism. Record the exceptions where the ICD-10 codes for hyperparathyroidism differ. When one or more parathyroid glands become overactive or secrete too much parathyroid hormone, PTH, the condition is called hyperparathyroidism. Every year, approximately 100,000 people develop hyperparathyroidism in the United States. Older women who are postmenopausal are at a higher risk of the disease. The parathyroid hormone is secreted by the parathyroid glands to help maintain an appropriate balance of calcium-phosphorus levels in the body. Calcium and phosphorus are important for the proper functioning of tissues. The parathyroid glands are about the size of a grain of rice and are located on the outside borders of the thyroid gland in front of the neck. Hyperparathyroidism is of two types, primary and secondary. Primary hyperthyroidism is also called PHPT. In this, enlargement of parathyroid glands produces an excessive amount of hormone which results in high level of calcium in the bloodstream. It is called hypercalcemia, and usually surgery is the most common treatment plan. Secondary hyperthyroidism is also called SHPT. In this, the calcium levels of the body drop down and result in diseases such as kidney failure. To keep the calcium levels normal, the parathyroid glands try to work overactively. In the initial stages, hyperthyroidism doesn't show any symptoms, but in mild hyperthyroidism, muscle weakness, fatigue, depression, joint pain or loss of appetite may occur. When the condition gets severe, nausea, vomiting and an urge to urinate might occur. The criteria for the diagnosis for primary hyperparathyroidism is based upon the persistent levels of blood calcium and elevated level of parathyroid hormone, while for secondary renal hyperparathyroidism we look at the persistent raised PTH levels, normal or low calcium and vitamin D levels, and raised phosphorus levels. It is important to note that the patient must have renal disease as a coexisting condition. In any case, one elevated PTH is not definitive for the diagnosis of hyperparathyroidism and it should be coded as an abnormal elevated lab result until a definitive diagnosis is reached with further studies. Let us look at the ICD-10 codes associated with hyperparathyroidism. For primary hyperparathyroidism the code is E21.0, and it falls under HCC 23. For secondary hyperparathyroidism which is not elsewhere classified the code is E21.1 and the HCC is 23. For other hyperparathyroidism, the ICD code is E21.2 and HCC is 23. For hyperparathyroidism which is unspecified, the code is E21.3 and HCC is 23. For other specified disorders of parathyroid gland, the ICD-10 code is E21.4 and HCC is 23. And lastly, for disorder of parathyroid gland, which is unspecified, the code is E21.5 and the HCC is 23. The assessment and plan should address the diagnosis as current and include two support indicators. Let's see an example of a progress note for primary hyperparathyroidism. Patient name: Jonathan Ross. Date of service: March 30, 2019. Date of birth: November 19, 1986. Assessment and plan: primary hyperparathyroidism. Stable. No symptoms. Monitor with calcium and PTH labs results. Follow up in 4 months. Exception: there are a few exceptions which one should keep in mind. Secondary hyperparathyroidism, not elsewhere classified with the code E21.1 has an excludes one note indicating secondary hyperparathyroidism of renal origin which is coded as N25.81. These two conditions cannot be coded together. Similarly, other hyperparathyroidism with the code E21.2 has an excludes one note of familial hypocalciuric hypercalcemia, which is coded as E83.52. These two conditions cannot occur together and hence should not be coded at the same time. We have reached the end of our short refresher course on other significant endocrine metabolic disorders. We gave you a short introduction to hyperparathyroidism, distinguished between primary and secondary hyperparathyroidism, identified the specific codes and HCC category pertaining to them, reviewed the criteria, assessment and plan for the diagnosis of hyperparathyroidism, and finally noted the exceptions regarding the excludes note for certain diseases. Thank you for joining us.